Hi, we are Team Norfolk, and our topic is reducing maternal mortality by tackling mental health. Our team members include Carl Larson, Natasha Singh Miller, Jasmine Lane, Hannah Skudlarek, Kathy Feinholm, and Tori Powell. Team Norfolk was surprised to discover that mental health is a contributing factor to a large portion of maternal mortality cases. One of the issues within mental health care is access to care, which can be attributed to financial, geographic, and social support gaps. We propose that the Commonwealth work to improve access to care for all new mothers, and especially those who may be facing these barriers. Our proposed solution is identifying those with a gap in access to care through a required questionnaire and providing home visits within 6 weeks of birth. Mental health conditions comprise 23% of maternal deaths in the United States. This includes deaths to suicides and overdose related to substance use disorder. Mental illness does not directly kill women, but it serves as an underlying factor that may result in suicide, accidental death, and death due to accidental drug intoxication or homicide. In 2020, approximately 64,000 women in Virginia were treated for mental health conditions, many of whom were within their childbearing years. As seen by these charts, mental illness was a critical factor in almost 1/3 of maternal mortality cases in Virginia. Furthermore, of those cases, the cause of death was oftentimes related to substance use. To combat mental illness and provide high-quality care, access to care is critical. Maternal mental illness is oftentimes negatively impacted by missed opportunities for treatment, missed appointments, and low social and familial support. The more a patient is seen by a provider, the more an important diagnosis or treatment can be provided. In order to do so, barriers to access to care must be removed. This map shows all mental health and substance abuse treatment facilities in the Commonwealth. Team Norfolk ran an analysis to show that census blocks and population are outside of a 30-minute drive time of a facility. As seen in this map, 495,392 people are outside of a 30-minute drive of a mental health or substance abuse facility. Additionally, there are many households that do not have a vehicle. Per our analysis, census data shows that approximately 30,000 households are outside of a 30-minute drive of a mental health or substance abuse facility. Many more are within the 30-minute drive range, but don't have easy public transportation to appointments. Team Norfolk is proposing to help reduce the risk factors associated with postpartum depression and mental illness leading to maternal mortality by having increased access to care. This would include telehealth services in conjunction with in-person home care or community group therapy sessions. We would also propose referendums to have prenatal and postpartum mental health coverage included in health insurance and Medicaid. But the question remains, how do healthcare providers identify new mothers who have difficulty with access to mental health services? For that, a questionnaire should be required for new mothers that specifically addresses access to mental health care. This questionnaire would be given 1 to 2 weeks prior to delivery and include the following questions. Have you ever sought the help of a mental health professional? How would you rate your access to mental health care during your pregnancy? Did you face challenges with transportation to healthcare during your pregnancy? Do you have access to a vehicle? How many minutes does it take for you to transport to an appointment? Are you aware of mental health services offered in your area? Are you aware of mental health telehealth services offered in your state? Would you be interested in a home visit by a mental health professional? And would you be interested in a telehealth appointment with a mental health professional? By identifying mothers who have difficulties with access to mental health care, critical gaps in care can be covered by healthcare providers, local community service boards, telehealth providers, and the Commonwealth. Here are our sources for the project, and thank you very much for your time.